Hello, everyone, and welcome to our webinar on parenting young children during COVID-19, how children respond and what they need. Thank you for being members of the Roundtable and for your continued engagement and support during this time. My name is Chetna Cates, and I'm the Director of Membership at the Baker Institute. I will start our event today with a quick introduction of our speakers, and we'll be taking your questions after the talk. Please use the Q&A feature at the bottom of your screen when you send in the questions. Ms. Marcy Melvin has experience in developing and implementing mental health programs, systems, and procedures in primary, secondary, and post-secondary educational settings. She is a child, adolescent, and family-trained licensed professional counselor and has experience in providing direct clinical and supervisory services to children, adolescents, parents, and young adults in a variety of clinical settings. Dr. Patrick Tennant is a project manager focusing on children's mental health at the Baker Institute Center for Health and Biosciences and a project manager of the Meadows Mental Health Policy Institute. Prior to joining the Baker Institute, he was a research partner at the Texas Institute for Child and Family Wellbeing and a practicing family therapist with a nonprofit counseling center. I'll hand it over to you, Patrick.
Thank you so much, Chetna, and thank you for that kind introduction. Let me go ahead and share my screen now. There we are. And thank you all for joining us today. We're really glad and honored to have you with us. Thank you for being here. Let me first just tell you that, again, we're talking about parenting young children during COVID-19. As Chetna said, I'm Patrick Tennant, and I'm honored to be joined by my colleague, Marcy Melvin. Marcy, in addition to being an expert in a lot of the things that we're talking about today, is also a top-notch clinician. So it's really, it's wonderful that she's able to join us. I'm really glad we'll all get to hear from her today. And I really appreciate her spending this time with us. So first, let me tell you a little bit about what we'll be going through today. Just a brief outline. We're going to start by talking about some of the challenges of parenting young children during COVID-19. And certainly you don't need me to tell you there are challenges associated with this, but we're going to take a little bit more of a scientific or academic view of this and try to understand it in a little bit more nuanced or intricate way. Next, I'll talk about the safe, stable, and nurturing framework put out by the CDC and try to map it onto the situation we're in right now. As well as the ways in which it can help us to understand and respond better and in a more helpful way. Then I'll toss it over to Marcy, and she's going to talk about how to recognize signs of distress in young children, including some ways that might not be intuitive or absolutely clear to most parents. And then she'll go into specific tips and ideas for parents, things that you can do for your children during that time. And finally, as Chetna said, we'll wrap it up with a question and answer session. And Marcy and I are looking forward to taking your questions and having a discussion with you about these things. So please do use that Q&A feature to let us know what you're wondering or what you'd like to hear more about. Now, before I go into any content, let me make a few administrative notes. Just a couple of quick things. First, we're using the word parent here throughout as sort of a shorthand, but really all of this information is applicable to any caregiver, whether it's a grandparent or an aunt, an uncle, a family friend, even professional caregivers. Anyone who's interacting with young children during this time can benefit from this information. The next thing is that young children is an intentionally kind of broad and imprecise frame to put on this. We're really thinking about kids maybe 3 to 8 or so here. But these are general guidelines, and they're not going to all perfectly apply to any individual case. And they will likely apply to a lot of kids outside of that specific age range. So don't get too hung up on any particular point in the case of any particular child. Developmental stages are sort of shades of gray. They blend into each other, and that's appropriate and okay. And just recognize that though we are focusing on young children here, this information is more in the form of general guidelines and can really be appropriate for kind of any age child and even a lot of adults. Finally, like I said, we do want your questions. We look forward to taking your questions, but please note that this is not really an appropriate forum for specific individual assessment or diagnostic questions. We're going to keep it general because Marcy and I are not in a position here to speak to any individual case. So please do try to keep it broad, and we will do our best to answer your questions as completely and thoroughly as we can. With that, I will go into the presentation. And I'm going to start by talking about challenges of parenting children during COVID-19. And like I said, obviously, if you have young children at home right now, you don't need me to tell you that this is challenging. But I think some people might even be surprised at just how challenging it is. And I think we can help to explain that a little bit through some of the scientific and academic work that's been done in this area. Some people might have imagined quarantine would look about like this, where mom and daughter are, on the bed together, working on homework, and everyone is calm and focused and happy. And maybe some people have had it play out like that. That's wonderful, and I hope that has been the case for some people. But I get the feeling that a lot more people have had experiences that looked about like this, like Rodney LaCroix, who has his children run by in the background on fire or naked or in ski masks during a video call with his boss. And that seems to really capture a lot of what some people have been experiencing here. And it's funny, which is great, because having a humorous take on this is a good coping mechanism, and sharing that humorous take is really helpful for a lot of people. So I applaud that. But what makes that so funny, what is really sort of hits home here, is that there's a lot of truth to this too. A lot of people are experiencing these struggles and having a hard time with keeping up with all of the things we're being asked to do right now, which is to work from home while also homeschooling children, while also just trying to be a parent and a partner and a friend, and to cope with all of these things and all of these changes in the span of a few short weeks is really a lot to ask of anyone. And then you layer that on top of anxiety about the economy, or anxiety about your own health or the health of people you care about. And it's really understandable that people are struggling during this time. And unfortunately, that struggle can take on some severe manifestations. Organizations from the American Psychological Association to UNICEF to SAMHSA, or the Substance Abuse and Mental Health Services Administration, have all put out warnings on potential increases in rates of child abuse, which is scary and upsetting, and unfortunately seems likely to be a result of this stress and struggle that we're going through right now. Then there's costs for adults as well, increased rates of substance abuse, general declines in population mental health. And all of that is also bad for kids. So those of us who focus on children and think about child well-being a lot are really worried about all of this. And that's, it's not to say that given all of the changes we've discussed, it's surprising exactly, but we still need to think about it and think about how we can best, moderate some of those outcomes for kids and make sure that kids are getting everything that they need. And when you're thinking about that, you might say, well, it makes sense that I'm struggling now. You laid out all the things I have to do, and it's just that's all there is to it. But if we look at it from, like I said before, a scientific or an academic perspective, we might get a little bit more intricate view of what exactly is going on. And Jay Belsky's model of parenting can help us to do that. Now, this is not a new model. It's been around for decades, actually. Here we see a slightly recent version of it. But what this model can tell us is that there are basically three things that influence how an individual is going to parent a given child. Those three things are first, the parent's characteristics, you see over here on the left, and that includes things like the parent's personality and the parent's mental health, obviously, as well as how they were parented themselves. So their own experiences growing up and what their parents were like. The second factor that's going to influence how an individual parents is characteristics of the child. And that's going to include, the child's personality or their temperament, as well as their mental health and, their experiences with with parenting or with being parented by those particular parents. All of that is going to influence the child and in turn influence how that parent is able to parent that child. And this varies child to child. It almost cannot not vary. And ask anyone with multiple children, I think they'll agree with me. You can't parent the same or parent two different children in the same way. Different kids need different things, and this is just sort of an acknowledgement of that. So all of that, I think, probably makes sense and is sort of intuitive as you would think about a model of parenting. But the third factor is really what I want to focus on today. And that's that factor up here that they call family or social environment, and that I would just call context as the context of parenting. This is going to include things like the family structure and the parent's marital quality, but it also includes things external to the home, like the parent's social support network and the culture in which that family lives. And it's this third factor of context that I think can help us to understand why parenting is so challenging these days. It's because you might rightly say, I haven't changed and my children haven't changed, but this has just become so hard over the last couple of months. And why is that? And it's that context factor that can help us understand it, because it's pretty clear that the context has changed at this point. That we're no longer in the same context of parenting that we were several months ago. And that change in context is just as important as characteristics of you or characteristics of your child. And so it makes sense that this has become harder, that parenting has become harder over the last couple of months. Now, I hope that fact alone can bring some solace, can validate and acknowledge and bring a degree of relief to some parents who are struggling. Is that it's not surprising and it's not unique to you. I think lots of parents are struggling during this time because the context has changed so radically. But acknowledging that context can also help us to see the important next question a little bit more clearly, because if you acknowledge the context is important, you also have to acknowledge that it's really out of any of our individual hands to change that context. But perhaps there are things that we can do to help our children adjust to this new world. And so I'm going to frame that question as what do children need during COVID-19? Now, to go to a slightly different academic literature, the CDC came out with a framework a few years ago that was meant to help families and communities prevent child abuse and other adverse childhood experiences and proactively raise healthy and thriving children. And that's great. This framework, like I said, was designed to aid in child abuse prevention efforts, but really it's a pretty good framework for, at the bottom line, sort of a minimum standard of what children need. So here's a picture of the front page of that report they call Essentials for Childhood, Creating Safe, Stable, Nurturing Relationships and Environments for All Children. And it's those three elements, the safety, stability, and nurturance, that I'm going to say constitute a really nice sort of minimum bar that we want to be crossing for our kids, that we want to make sure they have those things. And if we do that, it's a pretty good start. Now, obviously, kids need more than that. But again, focusing on what is in your control and doing what you can to make sure children have those things, you are doing pretty well during this challenging time. So let's dig into those three elements a little bit more. The first is safety. It's the extent to which a child is free from fear and secure from physical or psychological harm within their social and physical environment. And again, important to note there, this is not just physical safety, but also psychological safety. The fear, the psychological consequences of that for kids can be severe, and we need to incorporate that into our understanding of their safety. Next, stability or the degree of predictability and consistency in a child's social, emotional, and physical environment. Again, consistency, structure, routine, all very important for kids. And finally, nurturing, or the extent to which children's physical, emotional, and developmental needs are sensitively and consistently met. So there again, we have the consistency piece, which is, like I said, very important, but also the sensitivity piece, because children don't just need sort of the basic fundamentals of life. They also need warmth and love and care from their caregivers. And really that is on par with all of the other things we've discussed. Kids absolutely need those things too. And the nurturing element reminds us of that. Now, let's talk a little bit about if we use this framework, what we can learn about how children experience some of the threats to these things during COVID-19. Because, under this framework, we say we want to provide these things. Well, what's happened to them? If children were safe and stable and nurtured before, why might that have changed? And again, it's a helpful lens through which to think about the changes of COVID-19. So under safety, kids might be concerned about contracting COVID-19 themselves. And they may not understand that children seem to be less vulnerable to this than older populations. That's a fairly kind of nuanced and complicated idea that may be beyond the grasp of a lot of young children. So they might just understand that people are getting sick and worry about getting sick themselves. They also might be worried about losing loved ones, and that's a very reasonable and realistic concern, unfortunately. And if children pick up on that, they could feel a loss of safety from the perspective of losing a loved one. They could also have fears about losing financial or food security that, again, might be realistic, might be realized already, or they might not be quite as realistic in the case of that child, but they might miss the complexity or nuance of that change. There's also the concern about safety from parents getting more frustrated than usual. So parents becoming, having a shorter temper than they normally do can be scary and upsetting for kids and threaten their feeling of safety, as can the perception that their parents are fighting more, which I think a lot of couples are going through these days. Kids will pick up on that and can become worried that the family might split up, which is, again, another really real threat to safety in the eyes of a child. In the domain of safety, again, the degree of predictability and consistency in a child's environment. Obviously, there have been changes to routine. Just about everybody has experienced some change to their routine at this point, and that's especially hard on kids. The children might also have parents who are just behaving differently, so that the same basic routine is changed in the eyes of a child, and they can no longer trust that things will work the same way they did before. Or they might feel like they're no longer connecting to people outside of the home, and that sort of stability of connection, of positive social relationships is gone because they miss their friends from school or from daycare, or they miss their grandparents or aunts, uncles, and cousins. And that, again, that stability in social relationships is really important. Finally, kids might kind of recognize that there is some concern about going back to pre-shelter-in-place routines. And if those routines do restart, children might not feel comfortable going back to them. And that's a change to the stability or the consistency of a child's life. They might have to worry or feel that they have to worry about going back into a classroom or a daycare. And that routine might change for them. Finally, the nurturing element, self-care is what's really important here. Parents who are stressed out or concerned themselves are less able to care for, engage with, and soothe their children. They're less kind of available for the love and sensitivity that kids need. And so you can absolutely see declines in the nurturing of even what was typically a very nurturing parent. There's, again, challenges to just sort of the basic needs of that child, their food, their housing. Unfortunately, some families are going through very real threats to those things, and children can pick up on that and be concerned about that. And then some children might change their behavior. They might not seek out nurturance in the same way, so that parents need to be aware of and attuned to those potential changes, and not be falsely reassured that these children don't want love or sensitivity any longer, because that's not going to be the case. Kids will continue to need that even if they begin to behave a little bit differently during this time. And Marcy, thankfully, is going to go into more detail on all of that in just a minute. But before we do that, let's think about is it possible for parents, given all of these potential threats that children might experience, is it possible for parents to pick up on them and to be accurately and attentively attuned to their child's needs? And there's an academic study by Lai and colleagues that can tell us a lot about that, actually. So this is a study in which the researchers went and interviewed a sample of parents and their children who were affected by Hurricane Katrina. And these researchers interviewed mothers and their children and asked them about their experiences of loss or disruption to their life due to Katrina. And then went back subsequently months later after that first interview and collected information on the child's level of post-traumatic stress. And what this study can tell us about parents' ability to attend to children's signs of distress is really twofold. First, the parents did not always appropriately align, or their experiences didn't always appropriately align to their child's. So sometimes children reported more distress than their parents, and sometimes vice versa, with parents reported more distress than their children. But overall, the level of agreement, the level of alignment between those reports was fairly low, low to moderate is how the researchers phrase it, which means that some parents and children did align, they did agree in their reports of distress due to Katrina, but on average, people didn't, and that's concerning because, as we've discussed, you want to be attuned to, you want to appropriately attend to your child's signs of distress. The second important finding you'll see here in this plot, and I apologize for the messy graphic here, but I will walk you through it. On the y-axis, we have the child's post-traumatic stress symptoms at time 2. So this is the level of stress that the child reported from the trauma at the subsequent interview, at the second interview, months after the first one. And then here in the plot, we see there are basically 4 groups. And the important group is this one in the top right, which is a group of children who reported a high level of immediate loss or disruption, but their mothers reported a low level of immediate loss or disruption. So what you're seeing here is the gap between children who reported a high level of loss or disruption and their mothers did not report that. So they had misaligned reports. The mother did not appropriately attend or attune to the child's signs of distress. And down here at the bottom, even children who had a high level of loss or disruption, as long as their mother was attuned to that, as long as their mother appropriately sort of picked up on that, they did not experience any more post-traumatic stress than any of the children who had a low level of loss or disruption, right? So the mother's attention to this really buffered the outcome for the child. And the only children with really the worst outcomes were those with a mother who was not appropriately aligned to their experience of loss or distress during Katrina. This is important. It tells us we need to attend to this, but how can you do so? You know, things are very different now, as we've discussed, and you want to make sure that you're tuned in with your child. That's a great and appropriate goal, and so we're going to talk about how exactly you can do that right now. This is actually where I'm going to toss it over to my colleague Marcy Melvin, and she's going to take you through the rest of the presentation. Marcy.
Thank you, Patrick. So we're going to be discussing, how to recognize distress in young children, specifically, for those parents that may have multiple age children at different developmental ages. So we're going to try and understand that a little bit. Next slide. And so one of the biggest things that we want to look at in recognizing distress in young children is for a change in behavior, right? So some type of a consistent change in that child's behavior. It may be with their appetite, it may be with their sleep, or it may be a regression of behaviors. With their appetite, they may be eating less. This will be noted if we are talking about foods that your children may enjoy eating, but their eating habits or patterns are off. Changes in their sleep patterns. They may have difficulty falling asleep. So you may be consistently doing those bedtime routines, but your child may have more difficulty settling and falling asleep at night. Or maybe you can get your child asleep, but they may be waking frequently during the night, and maybe you're having visitors in the middle of the night where this was something that hasn't been typical of your child's behavior. And when we're talking about regression in behaviors, we're talking about maybe developmental milestones that your child has appropriately achieved. But now, during this time of sheltering in place, there seems to be a revert of those behaviors. So that could be like thumb sucking, or wanting a bottle. It could be an increase in baby talk. It could be young children asking for help completing tasks that they have demonstrated mastery in prior to COVID. So any type of those regressive behaviors can be an indication of distress in young children. Next, thank you, Patrick. And so let's kind of dive into like those two different age groups. So we're going to look at the age of 2 to 5. Those children may be, again, if you're thinking in terms of those regressive behaviors, then they may be more clingy or whiny or wanting more assistance. As a parent, if you're leaving the room for a few minutes and where that may not have been an issue before, they do not want to be left alone, or they're wanting additional time at bedtime, or maybe they're wanting the parent to lay with them at bedtime, or to sleep in the parent's bed. So again, we're talking about a change in behaviors that would have existed prior to the sheltering in place. Another really important characteristic would be like non-characteristic outbursts or tantrums. Frustration levels of, your child seeming to be really high. And we're talking about an inconsistent. So a child's reaction to a stressful event, those two things not matching. So if they're working on a puzzle and, are unable to get the puzzle piece, becoming more frustrated than they would typically be. Next slide, please. For children age 5 to 8, that frustration can come across as irritability or anger outbursts. There may also be a change in their engagement in things that they typically really enjoy doing. So if it's, a child that may really enjoy going outside and riding their bike, kind of losing an interest in that. A big symptom during this age group is going to be an increase in psychosomatic complaints. So headaches or stomach aches, or general overall not feeling well. And so you want to listen for those things and take note, because any types of this change and disruptive behavior that is apart from how your child typically responds may indicate that there is an increase in distress that they are experiencing. And as Patrick mentioned at the very start of this presentation, it's important to note that every child is different. And so even some of these signs of distress is going to be very specific to the individual personality of your child. So you won't be comparing your child to, say, their sibling or another child their age. You really want to think about if there has been a change in your child's behaviors based on how they're behaving now compared to prior to the sheltering in place. So it is very child specific. Next slide, please. So as we're going through and we're having these conversations, and maybe you are potentially noticing some distress, we're going to later cover what are some things that we can do as parents to help support our children. But we want to take a little bit of time to talk about how parenting practices matter, and just as I love how Patrick phrased that we're taking this academic approach just so that we can see the research behind some of the steps that we may potentially take. There has been a lot of research that supports that the way a parent experiences a traumatic event, and how they personally respond to that traumatic event, has a significant amount of effect on their children. And so it not only is that parent personally having to deal with, this traumatic event, but then they're also having to parent through this traumatic event. And so what we know, just looking at some of the research, that individuals or parents that may have high levels of personal distress, that distress will impact their parenting. And so the inverse is also true. Those parents that are able to manage their stress during traumatic, experiences, they're able to have a positive impact on their child's outcome. There's a way that they can impact their child's outcome by managing the response in a healthy and positive way. And so by doing that, by a parent managing their own distress, they can alleviate some potential negative harm for their children. One of the things that I love saying is that children are a reflection of their environment. And as adults, we have the ability to attempt to control and maintain that environment in which we want our children to be able to grow within. Next slide, please. It's really important to note that, positive parenting strategies can be learned. And there's, this particular study speaks to not just can those positive parenting strategies be learned and then have a positive impact presently on your child, and within the short term of the next 3 to 6 months, but those positive parenting strategies, when implemented consistently, can have long-term positive impact on children as they grow up. It's able to help equip children to be able to manage stressful or challenging environments. We're going to talk through what do these strategies look like when we're looking through it from the lens of the framework of safety, stability, and nurturing that Patrick had walked us through earlier. So here's some real specific strategies. And, when we're talking about children, it's really important that we are open and that we're honest with them. And so this whole pandemic can feel very scary. And I think it's important for us to note that as adults, it feels very scary for us. And so we want to be very careful on how we present that to children, especially our younger children, and so it's really important that we give them a balanced message. And so communicating that even though we are sheltering in place, we are doing things as a society to work together to help to protect everyone from the virus. And then making sure that they understand that there are individuals out there that are really working to protect us as a society, the doctors and nurses that are, working to care for those individuals that are sick, the scientists that are looking for either a cure or immunization from this virus, and that, we're all attempting to work together to do our parts. And so while there are individuals outside of the home doing their part, it's really important that we bring our kids into the conversation to let them know that there are things that you can do within your household and your family in which we can do our part as well. And so that's going to include, empowering kids to know how they can maintain their safety and the safety of others. That's going to be through making sure they're washing their hands, thoroughly and consistently, and then helping them know, what does that mean when we say thoroughly, right? So, saying the ABCs or singing the happy birthday song twice, and really encouraging and empowering them to be able to engage in these practices. Talking about, how do we maintain this safe space between ourselves and someone else whenever we leave the house. And for children, the concept of 6 feet may be a little difficult or challenging. And so in some of the families I've spoken with, we use the example of a hula hoop, right? So if a child is able to hold a hula hoop, and then the person that they're talking to, if they also have a hula hoop, then we don't want the hula hoops to touch, right? So that's the concept of maintaining that safe space. And so when we're using those terms with kids, with especially this age group, we want to be a little more specific so that it becomes a very tangible, actionable thing that they can engage in. And another thing when talking about safety is limit exposure to media. And so we're asking parents to limit their exposure to media, and with really young children, not watching media in front of the children at all. Some of the information that is being presented can be and sound very scary. It can sound very scary to us as adults. It definitely will sound scary to children. So we want to limit our own personal exposure, and minimize it, or not allow young children to be exposed to the media. And finally, we want to be honest and open, but keeping it as simple as possible. So when our kids may be asking us questions, being honest with the response. So young children, they may be missing extended family members, and they may want to know, when are we going to be able to see grandma, or why can't we see grandma? And so we want to be honest and open, but we also want to keep it simple. So we don't want to give them too much information about the risk for the elderly, and we really need to minimize the risk so that grandma doesn't get sick. That can sound scary. And instead, we can say, we are keeping our distance to keep everyone safe. And I know that you're missing grandma, so let's schedule a time to FaceTime grandma or Zoom grandma tomorrow, right? So acknowledging their feelings while at the same time kind of addressing it without giving too much information. Next slide. This is one of my favorite little clips, because it's really important for us as parents and adults to really listen to what are the concerns of our children, and not for us to assume. And I love this slide because this scenario sets it up where, this parent is at home with their child, and their young child, talks about some scary thoughts. And so the parent is like getting prepared to have a really hard conversation. And, okay, talk to me. What kind of thoughts? And the kid's response is completely different than what the parent thought, right? And so it's really important that when we open the door to really listen to our kids, that we listen through a lens of curiosity so that we can really understand what's motivating their concerns. And once we understand that, it becomes so much easier to validate their concerns, as well as kind of help them through that process. And so, thank you, Patrick. So let's talk about specific steps for stability. It's really important to maintain a daily schedule and routine. A disruption in a daily schedule and routine can be very disarming, especially to young children. And so we want the routine to be consistent yet flexible. And so what does that mean? It means let's have things that we can anchor our day in. And for children, meals is a very easy way to anchor the day. So breakfast, lunch, dinner at the same time, and then having a regular evening routine for them. Now, what happens between breakfast and lunch, there's some flexibility there as a parent, because parents are working from home and then trying to manage homeschool. So coming up with a routine, but not being rigid, is going to be really important for everyone. And as we're going through this, it's also important to for us to honor any family traditions as much as possible, and letting there be flexibility and adaptability on our part to make those things happen. Easter just concluded, and for many of us, Easter may be a time of huge family gatherings and lots of meals. So how do you honor that tradition while still maintaining safety in this current situation? One of the ways that you could do that is by being really creative. So scheduling, Easter dinner via Zoom call, so that all of the family can gather and eat at the same time and share fellowship using our technology. And while that's not ideal, it is definitely helpful to help us manage during this current time. And for stability, again, it is really important to set very clear expectations and follow through for our children. We can have clear expectations and follow through while delivering it in a very loving, compassionate manner as parents. So being loving, compassionate, and supportive is not the opposite of having expectations and follow through. All of those things can exist, and it's important for all of those things to exist. And while we're spending so much time together, it is really helpful to engage our children in this process as much as possible, allowing them to plan and manage and have some ownership in family events and activities. While I'm talking, I had a question to pop up about helping or having tips for helping children process their grief right now. And I just want to acknowledge that we received that question and that we're definitely going to get to it, Morgan. Next slide, please, Patrick. Yes, thank you. And so in nurturing, in order for a parent to provide loving, nurturing support to their child, parents have to first practice self-care and self-compassion. A couple of months ago, when we were still flying different places throughout the country, many of you that have flown recently can recall being on the plane and having the stewardess or steward go through all of the safety requirements. One of the requirements they discuss is when the oxygen masks drop down from the ceiling. They're very specific about the order in which individuals should place the mask. Parents are directed to place the masks on themselves first before assisting their children. And if you think about it, it makes complete sense, right? If a parent is attempting to take care of their child before they have taken care of themselves, then they may not have the capacity to then give the child what they need. So it is critical that parents engage in self-care, and that during this whole process, we extend grace and mercy to ourselves as parents. We extend grace and mercy to our loved ones, whether it's our spouse, our significant other, or our children. That is critical right now during this time. And again, we mentioned the need for limiting exposure to media. That is so important because there are times when you may feel like you're in a good space, but once you are inundated with too much media, it feels very overwhelming. And then, your ability to provide love and nurture to your children when you're overwhelmed, it doesn't happen. Um, Another way to engage in nurturing is to make ample time for engaged play, which means let's play with your kids. We're going to engage in child directed play, right? So your child is going to pick what they want to play, how they want to play, and we're going to be a willing participant engaged in that play with them. And so by us engaging in that play, one, that does a lot to foster that relationship between the caregiver and that child. It sends a message to that child of they are important, and that is so critical for their overall development, especially right now when times of stress are so pervasive. And then again, we talked about the need to really watch and monitor those behaviors. And you're looking for behaviors that may be slightly different. And so that also goes to kind of withdrawn behaviors. And so if you have a child that may appear a little more withdrawn, it doesn't mean that they're okay or that they don't need anything or want attention. Sometimes children who withdraw, they need parents to reach out and engage with them more intentionally. So attempting to recognize that and then respond to that. Next slide. So here is a study that talked about the importance of self-care. And so in some of the research that was done post Hurricane Katrina, what they were looking at was, parents who experienced high levels of distress inadvertently were placing their children at greater risk of experiencing some type of a post-traumatic stress response. And so what was drawn from this is how important it is for parents to monitor and be aware of their own levels of distress and to make sure that they are utilizing self-care and reaching out to resources to help support them as parents in order that they can then have the capacity to be supportive of their children. Next slide, please. So what do young children need? They need us to be aware of any types of distress that they may be experiencing. And know that with young children, that distress is going to come across through their behaviors. So it's going to be important for us to watch and take note of any type of behavioral changes that they may be having. We can do our best to make sure we are providing safety, stability, and nurturing to our kids. And in order for us to provide, safety, stability, and nurturing, we got to start with ourselves by being very gentle, showing ourselves grace and mercy, taking care of ourselves in order that we can then be able to take care of our children. It's really important to note that children learn through our actions and interactions with them. And so utilizing the piece that we can model for them appropriate ways of managing stress and frustration. So as a parent, that modeling can take the shape by just even verbalizing to your kid, I'm feeling a little upset right now, or I'm feeling disappointed that we weren't able to maybe have Easter dinner. And so even though I'm disappointed, I am really glad we were able to at least see our family members on Zoom. So naming the emotion that we may experience and then kind of pairing it with what we did to try and address that emotion. I am a huge proponent and think it's really important that parents are able to name their emotion in order that they can manage their emotion. Because it's like, in order for kids to learn how to name it, to tame it, they have to see it demonstrated by a caring adult in their life. And so as we roll into the question answer part of this, I'm going to turn it over to Patrick, who's going to share with us a couple of hopeful notes.
Thank you so much, Marcy. That was wonderful, and I know we're already cutting into our time for Q&A, so I'll go through this very, very quickly, and then we'll get to the questions that have been asked. First, I just want to recommend this article on post-traumatic growth. It's by Scott Barry Kaufman in a recent issue of Scientific American, and it's a really important idea right now that there can be growth to come out of this. Not to say that this is a good thing or that we want these challenges to be happening. But there can be growth, and that's true for kids too. And I think recognizing that is very important. So I'm just going to highly recommend you go and look through this article. And then the last piece is this quote, this tweet, which is I think a beautiful idea, sort of a nice sentiment by itself, but is actually a really good pointer to something else that I think you can be doing right now that is important, which is working to practice gratitude. Finding something to be grateful for, even in challenging times, can be hard, and it's not always appropriate. If you're in crisis, it may not be the right moment for that. But if you have the time and space to do it, it can be a wonderful thing that brings a lot of mental health benefits with it, and you can teach your children to do it too. So I would just encourage y'all to think about that, think about practicing gratitude in any little way that you can. And with that, let's move into the question and answer. And so I will hand it back over to Chetna.
All right, thank you both very much. That was really good. Let's start off with the question from Morgan. Can you give us some tips for helping children process their grief right now?
Thank you, Chetna. Thank you, Morgan, for that question. I have a feeling I know how Marcy will answer this, and I love her answer to this. So I'm going to throw it over to Marcy to answer this one.
Thanks, Patrick. I think one of the first things that we can do as parents is to recognize that their grief right now is very real. And something else I want to remind parents as we're talking about the grief of children right now is that they are experiencing, this may be one of the first times in their life that they're having to experience this level of grief or this level of disappointment. Now, as older individuals, we would have experienced grief and disappointment, and we're able to know that we're going to be able to weather it and get through it. For a young child without that life experience, it's going to feel completely overwhelming and daunting and like the end of the world. And so one of the best things parents can do is to validate their child's experience, to validate that grief, and get curious about it, ask questions, and then ask your child, what would make this situation better? Not what's going to fix it, because we're not going to be able to fix it, but what can we do so that you feel less bad, right? So on a scale of 1 to 10, if your child is feeling like an 8 because things are so hard, let's find out what can we do to bring it down to a 5. And engage your child in this, and knowing your child and knowing some of the things that they like to do, suggesting those options for them, and then allowing them to select what feels right for them.
Thank you, Marcy. I love that. I will just add in there real quick, Chetna, that I think something Marcy said earlier, which is modeling for the kids how they can respond to this, modeling that it is okay to feel grief about these things, is a really important way of validating for them that you know what, in fact, there is something to grieve over here, and that's okay. And really, grief gets better when you acknowledge it and process it, right? And so your kids need to see you going through that process as well.
Okay, we have a few questions coming in, one of which that I, as a parent of a young child myself, have been wondering, is this going to leave a lasting impact on our children? And if so, what should we expect?
Yes, I think it's fair to say that it will leave a lasting impact. I think it will leave a lasting impact on all of us and our society as a whole. Children are a part of that. And so I don't think we can expect that there won't be some impact from this. What exactly that will be is hard to say because we've never been through a situation exactly like this before. But as you look through the academic literature, like we did a little bit today, you can get some hints that children are going to experience a sort of big, broad societal level change like this in a different way than adults do. They're going to process it differently, and they're going to have different concerns and hopes coming out on the other side of it. But as kids go through these things, what they really need is their parents to support them. And so the kids who do the best going through this will be the ones who feel like their parents are there with them, taking care of them, and doing the things that they need to do to provide safety, stability, and nurturing. Marcy, you're welcome to add to that if you'd like.
I'm going to completely agree with you, Patrick. It's again, children will be impacted by this. And instead of us as parents attempting to guess and, about what is the worst part of the situation for them, let's ask them, right? So what is the worst part about this? And then just supporting them through that process.
Okay, thank you. We also have a couple of questions on, do you have any tips for parents on balancing the demands of work and, the ebb and flow of work and trying to keep the schedule for the children? You have some ideas, tips that you could give us?
Patrick, can I jump in and then I'm going to turn it over to you if that's okay?
Please.
I'm going to start with, just redefining the whole concept of work-life balance during COVID. It's about work-life harmony. So how do we get through the day in as effective a way as possible? As I mentioned before, finding things to anchor in your day that you can be consistent with. And for young kids, meals seem to be the easiest thing. They eat fairly consistently. So starting with the meals and then carving out small activities for both them as well as yourself, thinking about when you're going to be able to get work done during which points or which times of day. And having grace and mercy. I know I keep saying that because I feel like that is so important right now. We are all doing the absolute best that we can given this current situation. And, we may have demands on us wanting more, and we're still doing the best that we can. Patrick.
Agreed. I cannot second the idea of grace and mercy strongly enough. We all need more of that right now. So please do keep that coming. I'll also say that just as stability and structure and routine are good for kids, they're good for adults too. Maybe to a varying degree, but we all benefit from some structure and routine, while also incorporating that flexibility to accommodate things that come up that are unexpected. So being gentle with yourself in the way that you incorporate structure, but doing your best to get some structure in there. And I will say, maybe not everyone has this option or luxury really, but as much as you can, setting some confined times for work. Not letting work creep into your evenings and your nights, if it is possible and you are able to do so without obviously jeopardizing your employment, to put away work from time to time and be very intentional and conscious about that. That you just because you are home and working from home now doesn't mean you need to be working all of the time. So I'd create that sort of clear and firm boundary around that.
Thank you. We have another question that I'm going to read in its entirety. What about when an insightful child asks questions that almost requires you to be honest and recognize when you're trying to skirt the truth about the reality of what is happening in the world right now? Do you tell them the whole truth?
So I'll echo what Marcy said in the presentation, which is you do want to be honest, but they don't need every bit of information. And again, it depends a little bit how old precisely that child is and developmentally where they are and what you think they can handle, because this will vary child to child. But I would want you to be honest with them while also not providing them with every detailed bit of information, because they don't need that. And maybe one trick for doing that would be to turn it back on them. Ask them what they are thinking, what they have heard, and obviously if they've gotten some misconceptions or wrong ideas, you can correct those things. But again, you don't need to go into a great amount of detail. You can sort of put it back on them and ask what they're thinking and feeling, because that's really what's at the bottom of those questions, is that they have some concern they're trying to get addressed. And the only way to address that concern is not just providing information, but to comfort and nurture.
I would agree. And then Patrick, I would just share that last question I had mentioned before, asking the child, what's the scariest part about this for you? What is the part that you fear the most? Because that helps to get at what may be kind of motivating some of their questions.
Okay, since we are out of time and we still have a couple of questions, I'm gonna ask a question real quick and then request something of you guys. I know that we've got quite a few grandparents on right now. I recognize some of our members that have grandkids. So any special advice for our grandparents? And as well, before you close, will you please give parents some ideas on resources that we could look into? Are there any video conferencing therapists? What else can we look for?
Great, thank you, Jenna. For grandparents, you have a special role during this time. You obviously care for and want to support and provide for your grandchildren, but you also get to do that for 2 generations, right? You get to try to protect and support the parents who are your children, and that can be hard and challenging, and especially remote. If you're keeping social distance to try to keep yourself safe, that's obviously understandable and appropriate here. But doing your best to be available to interact with the grandchildren and sort of play games with them in whatever way you can find to do that, while also being available to the parents so that they can let off some steam about their own struggles with this. It is really hard working from home and raising kids and homeschooling kids all at the same time. And acknowledging that and encouraging your children to talk to you about that and to have you as just sort of a sounding board for some of their experiences during this time, I think is a great way the grandparents can help and indirectly help the grandkids too. As for resources, Chetna, thank you for asking that. We have a few here in these last slides. These are tips on parenting during this time, specific things put together by a variety of very highly thought of organizations. And a lot of the stuff that we talked about today is going to be covered in these tip sheets here. So we'll find a way to get this information out to everybody. And then if you have specific mental health concerns or questions, like I said, we also want to encourage you to use this information or to talk to your pediatrician or family healthcare provider, because there are absolutely resources out there available to get those things addressed right now, even via telemental health and things like that. So please be proactive and take steps to get yourself taken care of, or your children taken care of. And as Chetna said, if you're interested, you're also welcome to reach out directly to me. I'm happy to interact with you all and do whatever I can to help.
Okay, Marcy, would you like to add anything?
The only thing I would like to add, and I was looking at some of the resources that Patrick shared, Health and Human Services has a 1-800 hotline for the entire state of Texas, where once you call in, you can be connected to a licensed professional counselor for free and confidential counseling and support. And so, that's an additional resource that I think would be really helpful for individuals to have. As parents are going through this is very challenging. And again, it's so important that we get parents taking care of themselves in order that they can then have the capacity to be able to lean in and take care of their children.
Okay, thank you both very much. Like Patrick said, if you guys have any additional questions, please feel free to email Patrick at pstennant@rice.edu. Also, if any of you would think that this may be helpful for your friends and family, please send me an email at roundtable@rice.edu, and I can send you a recording of this event that you can forward to your friends and family. And again, thank you both very much.
Thank you.
You're welcome. Bye, everybody.